the most common cancer for men, with approximately 1 in 8 men in the U.S. experiencing a diagnosis. However, not all men require active treatment, and here to tell us more is Dr. Bhatnagar from the Prostate Cancer Institute of Arizona. Welcome, doctor.
Thank you. Thank you for having me.
Absolutely. Well, thank you for being here. This is a super, super important topic. We were just talking about this. So explain a little bit about what active surveillance actually is.
Well, that's an excellent question. So for men with localized prostate cancer who choose not to undergo an active treatment like surgery or radiation therapy, they can be closely monitored with frequent visits with their doctor, blood work, and in fact, they even have to go under repeat prostate biopsies, so every year or so. So clearly, active surveillance doesn't mean doing nothing.
Right. Well, yes, it's right there in the name, right? It's active. This is something that it sounds like you're watching it. You're keeping a very close eye on it. It is active in its nature, but it's maybe not invasive. Is that what you would say?
Yeah.
Okay.
But it's not something you can just, forget about.
Absolutely. No. Yeah. This is cancer. I mean, this is very, very serious. This is something you want to keep a watchful eye on and make sure you're taking care of your body. So, who are the ideal candidates for active surveillance?
So typically, these are men that have been categorized to have a relatively low risk of prostate cancer spreading outside the prostate.
Okay.
There are a variety of factors that help determine one's risk, including modern genetic testing that can help determine how aggressive their cancer is.
Very interesting. So are you saying that for certain men, active surveillance can result in the same process that like a radiation or something else like that would be?
So there has been long-term study recently showing that the survival rate for men in the active surveillance group was equivalent to men in the active treatment group. However, 75% of the men in the active surveillance group did eventually progress and required an active treatment. So that's a big caveat.
That is a big caveat. And so when we're talking active treatment, that would be something like radiation, that would be something like chemotherapy, surgery. Okay.
Yeah, surgery or radiation therapy, such as what I do, brachytherapy.
Okay, interesting. And so how long of a process would that be for someone who starts with the active treatment and then could potentially move into? I mean, is this something that you don't know the time period?
Exactly. It could be years.
Okay, gotcha.
Exactly.
Okay. Very interesting, but it's good to start with that the active surveillance, watching it so it's not too aggressive right off the bat. Is that correct?
Yes. The beauty about this is that it allows you to delay the treatment, which allows them to delay the potential side effects of the treatment, and such as impotence or incontinence.
Wow.
And then for many men, that's very important. They don't want to risk their potency.
Absolutely. I mean, yeah, that makes a lot of sense. And so for people who are doing active surveillance, is it common that then you wouldn't have to do any treatments at all? Is that something that could happen?
Well, based on the study, 75% eventually do require treatment.
So it is a lower percentage. It's more than 25%. But hey, that's still a percentage. That's still something.
And for the 75%, that they bought some time without having to deal with the potential side effects of treatment.
Okay. All right. So it sounds like it's something that maybe isn't 100%. Obviously, like you said, 75% will probably need some treatment. But you're delaying those negative effects, and there is the chance that potentially you might not need any treatment at all.
Exactly. You did great. That's a great assessment.
Well, yeah. Well, that's really, really valuable. That's really important. And since it is June, it is Men's Health Month. Is this something that people need to come in and start getting checked, like even if you feel okay, or is this something that you wait for symptoms to go in?
You need to go see your doctor to see who's appropriately a candidate for prostate screening.
Okay.
But generally speaking, men over 50 would benefit from prostate screening, but there are other factors that could require earlier screening.
Lifestyle factors.
Yeah, so it's important to go to your doctor.
Gotcha. Okay, so for those of us who are looking for a doctor to work with, tell us where they can find more information about you.
Yeah, so you can go on my website, prostatecancerinstituteaz.com, or our phone number, 480-360-4009.
Perfect. We have it right there on the screen. So if anybody's looking to get that screening, look into this active surveillance, they can come and reach out to you. Thank you so much, doctor. We really appreciate all that information.